Completing an APT, unhelpful or challenging behaviors. When we complete an assessment and planning tool, we make three lists. The first is the unhelpful or challenging behaviors list. The second is the problems to be solved. And the third is the thinking skills. In this video, we're going to talk about the first list, unhelpful or challenging behaviors. First, let's talk about what an unhelpful or challenging behavior is not. It's not a thought or a feeling. Thoughts and feelings are internal. Behaviors are external. Behaviors are something a person does. It's an action they take. Thoughts and feelings are something that they think or feel, right? It's inside of them. So when we see thoughts or feelings on the challenging behaviors list, we want to ask ourselves, how do I know the person is having that thought? What shows me that the person is having that feeling? And that will lead you to understanding what the challenging or unhelpful behavior is. Expectations. Expectations are not behaviors. They are the rules or the chores or right the things that we are wanting a person to do or that they're wanting to do for themselves, expectations that they have for themselves. They may lead to challenging behaviors. An expectation, completing an expectation, doing an expectation, like making the bed. Maybe that's the expectation in the morning and the person makes the bed. That's a behavior. They're making the bed, but it's not a challenging behavior. It's not unhelpful because they're meeting the expectation. When a person does not meet the expectation, that's the challenging behavior. If they don't make the bed, that would be a challenging behavior. But the expectation itself, stated in the positive, making the bed, is not the challenging behavior. Triggers are not challenging behaviors. Again, triggers can lead to challenging behaviors. They may cause some kind of dysregulation and that the person can't manage very well and may lead to challenging behaviors, but they themselves are not the behavior. And lastly, lagging skills. Lagging skills are, they're neurocognitive abilities. And they are the why behind behavior, usually, because a person doesn't have the neurocognitive abilities to manage whatever the situation is. And so they have behavior, a challenging behavior, as a result. But the lagging skills themselves are not the challenging behavior. So, what is challenging behavior? Unhelpful or challenging behavior is the concrete, observable reaction to any of those things that we just talked about. It's what a person does, it's their behavioral response. It's something that you can see, usually. It's an action that they're taking or not taking, not making the bed. And in some way, it's either unhelpful to themselves or challenging to somebody else. And honestly, it's their best solution in the moment, their best attempt to address whatever concern they have, to manage the situation that they're in. And it's challenging or unhelpful because it's not a great solution. It's not the solution we would like them to have. But given their lagging skills, it's the best solution that they can come up with in that moment. So ultimately, it's something that we want to help them decrease or eliminate. That challenging behavior, that unhelpful behavior is, our treatment goal, our ultimate goal is to help them decrease that and not have that challenging behavior anymore. So why do we make this list? There's a few reasons why we start with the list of challenging behaviors and why we want to make this list in the first place. First, to acknowledge the behaviors and to validate, especially if we're working with caregivers, to validate their reactions to and concerns about the behaviors. Most of the time, these challenging behaviors are why the youth is referred to our care, right? They are what the referral source, what folks want us to work on. And they're what is, driving the caregiver crazy. I mean, they're what is causing distress in the family a lot of times. And so we really want to sit with the caregiver and listen to and hear their concerns about these behaviors. And to express empathy around that, to validate their concerns around that. So the making this list, having that conversation allows us to do that with them, allows us to, listen and have empathy and understanding for what they're going through around these behaviors. We also can get a good sense of the severity of the behavior, of the duration of the behavior, of how often it happens, so that we can do good safety planning. So there are some behaviors that don't require safety planning, but there are some behaviors that do. And if we use this as a starting point, we can immediately start to think about, what are the safety plans we need to put in place. And then, important for collaborative problem solving, we these are the starting point to identify what the problems to be solved are, and they give us some clues to discover the problems to be solved. So on the APT that you'll find in GuideTree, that first list, that first box of unhelpful or challenging behaviors has some prompts that can remind you about what you're looking for. And, first of all, it says list the behaviors you see. So it's just emphasizing that these are actions. These are something that you're seeing the youth do or the people around them do. And we want to also consider all 5 systems. This is a systemic assessment. And so for the youth, we want to consider, in all kinds of settings, what are the behaviors that we're seeing? So at home, at school, with their peers, and in the community settings, what are the behaviors that we see in all those different settings? Because they may be different in each setting. And then the 5th system is the family system. And we want to also consider what are behaviors that family members are having that are causing difficulties, that are unhelpful or challenging, that are getting in the way, that are things that we want to address in treatment. So, considering all those 5 systems, and then we want to be specific about the behaviors that we're seeing. So I'm going to give you some examples. First, a poor example of something that you would see on an APT, and then a better example of how that should look in the unhelpful or challenging behaviors list. So the first example is physical aggression, and that is not specific enough. That is too general just to say physical aggression, because that could mean all kinds of different things. And so we want to ask, what does it look like? What does the physical aggression look like? What is the person doing that's physically aggressive? So we might hear that he punches his brother. So that's a good, specific, clear action that the youth is having. Procrastination, another one that's too general, too vague, right? Procrastination could be about or around any number of things. So let's get a little more specific so we can understand what's going on. So putting off homework assignments until after 10 p.m. the night before they're due is a very specific way to talk about the procrastination that the person is having. Yells at dad when asked to take a shower. So this is an example of, and we see this a lot, of how the challenging behavior and the problem to be solved are combined. And we want to disentangle those and put those each in the appropriate list. And so we want this does contain the challenging behavior. Yelling at dad is a challenging behavior. But when asked to take a shower, is the trigger. It's the unmet expectation, or it's the expectation that's hard for the person. So that's going to go in another list, right? That's going to go in the problems to be solved list. Yelling at dad goes in this list. Smokes weed in the park when peers pressure him. This is another example of how the problem to be solved and the challenging behavior are combined. So we want to disentangle those, put the problem to be solved in its own list, and retain the challenging behavior, which is smoking weed in the park. Depression. So here's an example of a feeling, right? That it's depression isn't a behavior. Depression is a state, right? Or a set of feelings. And so you want to ask, what makes you understand that the person's depressed? What do you see? What are they doing that tells you that they're depressed? And that would be the challenging behavior. So isolates in her room is an example of a challenging behavior. Doesn't agree with school rules. So this one's a thought, right? We have a feeling and a thought here that are not behaviors. And so again, ask, what does the person do that shows you that they don't agree with the school rules? And in this case, they're wearing their hat in the school hallway. And that's a rule that you can't wear your hat in the hallway. So these are all better examples in green of what you would want to see in the unhelpful or challenging behaviors list. And lastly, let me show you let's talk about which one of these might you create a safety plan around. So as I said, not all unhelpful or challenging behaviors are unsafe behaviors, but some of them are, and we would want to gather more information to understand, whether we need a safety plan and what that should look like. But the two that I would identify on this list are punching his brother, because that is something that hurts another person. And smoking weed in the park may be something that is hurting the youth themselves. And so both of those I would want more information about. I might do a situational analysis to understand if we need a safety plan. So let me give you some examples for family as well. Those first examples were all about the youth, right? And so they were at home, at school, with peers, and in the community. And then these are some family examples of behaviors that family members may have that would get in the way, or would be things we would want to address in treatment. So mom missed her doctor appointment. That is a behavior. She missed the appointment. That may have a negative impact on mom or on her parenting, right? So it's something that we might want to address in treatment. When the caregiver doesn't give the youth a specific time for curfew. So this is an example, and we see this a lot, of a parent is not following through on the rules that they set, or they aren't setting rules very clearly for the youth. And so that's something definitely that we would want to address in treatment. The youth's sister screams and throws her shoes at the youth. Clear behavior, right? And something that probably we would want to address in the family treatment. Grandfather threatens to spank the youth. So threatening is a behavior, and that's something that we would want to think about with the family and with grandfather. And then the parent often cancels visits at the last minute. So maybe a non-custodial parent that has arranged visits and is canceling. That's a behavior that we would want to explore. So those are examples of how you would make the unhelpful or challenging behaviors list in the assessment and planning tool in the APT.